Hello everyone, welcome of the Jumpstart Your Career in Healthcare Analytics. My name is Siuwin Wang. For today, so we'll talk about the current analytic trend in healthcare and then why, in healthcare we're using analytics in this. So first of all, it's really about the whys. We're adopting the evidence-based approach and value-based care in healthcare. So that is very important to make informed decisions in hospitals and in healthcare sector overall is very important. The goal is to aim for looking at the quadruple aim from the IHI, so the Institute for Healthcare Improvement. When we're looking at the quadruple aim, included the better outcomes for the patients overall, and then improved patient experiences, lower cost per capita, so lower cost per patient spending, and then also improved overall clinical and clinician experiences. So sometimes it might be also considering the organizational readiness on the HR front as well. So utilizing data in healthcare analytics really help to make those informed decisions. So we're looking at improved efficiencies, better outcomes for patients, lowering the financial cost. How can we spend every dollar in healthcare more effectively, have more of a value, and overall improving the patient experiences as well. And how can we also take care of our human resources from the HR perspective. So having improved working conditions, environment for our clinicians as well. So this is the why we're going to use the analytics and data in healthcare and then to drive these objectives as well. So nothing too much different from other speakers prior. I'm still going to apply the same model from Gartner. So this is the Gartner predictive models, where in analytics it's divided into 4 stages. So I won't repeat too much on the definition for each one, but then knowing where healthcare are right now, I think most of the organizations in the healthcare field are around level 2 and level 3 for those kind of stages. So level 2 is really talking about why certain things happen, but then for level 1 is really understand what had happened in the past. And then when we're looking at the prediction, the predictive level for predictive analytics is really about predicting what will happen. And then the last stage or the 4th level is called the prescriptive. This is where if we have the power of the analytics, we can predict what will happen and then also understand the impact of those events. Let's say if certain ED visit demand for ED visits will go up, and then there are going to be more patients at certain day point in time, then what will happen, right? So that would be the number 4. We can use data to looking at staffing levels, to look at reduced wait time for those patients on that day, and then looking at financial cost. Also, how do we reduce the overall costing for those kind of activities? So this is where the optimal stage for the analytics. But then for majority of the healthcare industry and then for organizations, most are still at level 2. Some more advanced, they're at level 3. Some of the prediction modeling involves a little bit more on the data science front, looking at big data for data prediction modeling, where people put it into place to correlate ED visit data with the weather, with certain contribution factors to the data as well. So this is where majority of the healthcare facility at, and then still there's a lag in moving from one level to the next. So majority of the healthcare organizations still struggling at the level number 2. This is where a lot of need for analytic professionals will surface in the next 5 to 10 years in the healthcare industry as well. And then a lot of these will also require the attention for the management, the higher management or the top management in healthcare, really to invest in these fields about analytics, because all the decisions nowadays being made are based on data. So data is very valuable to come by, and then how can we turn those raw data into more of a meaningful insights and to inform those business decisions in the healthcare industry. A glimpse into the future in this trend. So knowing a lot of those healthcare organizations are still at the level 2 and some are level 3s, there's a gap in moving the level up for most of the healthcare organizations, where the data literacy and education is also a must for for the industry to understand the importance of utilizing data to solve problems. With those being said, in the context, the need for data and business insights will grow over time. And the use of BI tools for big data, machine learning, AI technologies will come through those period as well. And with all of those, the data need, business insight, the tools, but then in the end, we still need skilled analytic professionals in this field. So there's already a gap being identified in the healthcare industry. Not a lot sort of a good candidate or talent can be found in here. So when it comes to recruitment, there's always a lag in finding the right candidate. So there's some difficulties in finding the right people with the right skills that will be able to help that. So on the right side on this picture, just want to talk about that. So this is a report that had done by the PwC, so Price Waterhouse Coopers. So they had looked at the job market. Let's say, for example, in the 2015, back in the years, open job asking for analytic skills, right? So 2.3 million. So 2.3 million, and then in 2018, that number just gonna grow. And then you can imagine by now, 2021, there's still an increased number of those jobs being asked for in overall the industry. And healthcare is one of the many other industries are competing for the same professionals with the analytic skill set. So talking about the professionals in analytics and the skill set. So let's talk about the recruitment experience I had, and then to help you maybe identify some of the good qualities for a candidate, when it comes to interview. And these are very, I would say, unique characteristics that are very helpful to land in a role. And then these mostly, I would say, soft skills. And then as you can see, I put the technical skills down below at the bottom. So the first thing, I think, being the qualified or good qualities in the analytic profession is all about the attitude. Having continued curiosity about certain things. There's always new technology, new data, or new things. So the willingness to learn is also very good. And also the can-do attitude, right? So when we face new challenges, new problems, then we don't say, oh, that's something I don't want to solve. That's, a challenge I want to back down. So this is something we can always look forward to. We welcome challenge in that area. And then this is where one of the key characteristics for a good candidate will show. And the second piece is very important is the communication, the soft skills. I really rank the soft skills way more than the technical skills, because it's really about having the ability to become, I would say, the knowledge broker or information broker between the technical and non-technical audiences. So imagine if you're, delivering a presentation in the healthcare field to nurses or doctors or allied health professionals. Those clinicians were not being trained for stats, so they would understand the basics, right? But then if you are bringing very technical terms in statistics or talking about numbers, how would you bridge that gap if someone is having difficulty understanding those technical terms? So the communication becoming very important now these days about how do you get the idea across to different audiences, especially for non-technical people. But also it's also important to the technical people as well. Let's say if you're working with developers, the business requirement will always come from the clinical side. Let's say if clinicians need something, then they don't have the time to do it. They need to focus their energy to on the treatment for patients, and then think about treatment plans and medical treatment. But then for the technical personnel, the programmers or IT professionals or the data professionals, you have to understand the business requirement and then translate that into the technical language for those people, and then to make the solutions that will fit in as the original ask from the clinical side. So emphasize on the communication skills, soft skills are very important. And then I will put number 3 as the team player. So work well with others. There's always going to be a team environment, because nowadays if you're trying to achieve anything alone, you can get there pretty fast, but I would say it will be harder to go further along the way if you're a single player in the field. So this is where a teamwork will be very important. So we work with everyone, understanding the importance, having team members to support each other. And when we all come over with, when we all face challenges, so we can all come together and then solve those problems. And solving problems, so problem solving is all about generating alternatives. So there's some different steps in problem solving techniques, but then think about what you're gonna do every day. So we're doing problem solving every single day, right? So where do you want to eat? Where do you want to sleep? What time do you want to wake up? What time do you want to go to bed? So all of these questions are problems, and we do them every single day. So we don't realize we're doing problem solving every single day. So it's just different kind of problems when we face a question or issue. And for a good candidate, there's always a good demonstration, the ability to solve those kind of problems, or coming up with new ideas or ways to show the capability and competency on that as well. And then lastly, the technical perspective that will come in. So having experiences working in certain BI tools, say for example Tableau, Power BI, Click, Looker, all of those data tools, or even the statistical ones such as SAS or SPSS, or R or Python, things like that. So knowing all of that will help, but then really you have to tailor that to the actual job posting you're looking for. For a good candidate, you will almost fill in, I would say 80% of those technical requirements on a job. And then for the last sort of the 20% are from the soft skill set. And that's where you'll be demonstrating that during the interview. So for technical skills is always assets. You can always add something new. You can learn a new BI tool, a new programming language or something like that. But then for soft skills, it's harder to come by, especially with the right attitude. You want that person to be able to always ask the right questions, being curious, and then think about what to do next on focusing the key objective of the day, and communication and being the team player. So these are the good qualities of a very good candidate. So these are sort of my recruitment experiences, over the years, and then I want to share that with you, and hopefully that will help you to sort of set some directions for your future growth and learning in the profession as well. So I would like to close up with this quote from Steve Jobs. So the only way to do great work is to love what you do. If you haven't found it yet, keep looking and don't settle. So I really love the quote. It's all about finding the right job to do and finding your passion, finding your purpose. So this is where you might find a job that is pretty interesting to you, but then you always think about, okay, what else am I missing, right? So did you put yourself up to the challenge, or did you settle for now saying, okay, this is good enough for me, I'm pretty comfortable, and what else I'm missing? So always ask those kind of critical questions, to yourself, and then always ask yourself, are you happy right now where you are at? And what's your goal? Really, what's your objective? And to look down deeper within yourself and think about what to do next, that will always help you and to build more confidence, because once you set your purpose and objective, you have your eyes on the goal, right? And then once you have your eyes on the goal, you know what exactly you're going, or what you're going to do, and it just slowly to make it happen, and everyone will get there one day. All right, so I think that will be all. Thank you for listening, and wish everyone well, and stay home and stay safe, and we'll see you soon.